might be an issue.
Good morning, everybody. Let's give everybody just about 10 or 15 seconds to get admitted to the from the waiting room. All right. Well, good morning, SWTA Nation and beyond. I'm Amanda Webb. I'm with Southwest Transit Association. And before we get started on today's webinar, which is Building Resilient Teams to Combat Burnout and Improve Your Safety Culture, we have just a little bit of housekeeping, so let's get that over with. So today's webinar is being recorded. We will provide a copy of the recording later this afternoon, along with any slides that the presenter has. Any questions that you have, feel free to throw those in the chat box at any time. Our presenter, Charlotte, really wants this to be an interactive webinar, so just feel free to throw those in at any time. We'll have times during the webinar where we might have a poll or ask you to participate in the chat. And so just, take advantage of that opportunity. Anybody who attends today will receive a certificate of attendance. So if you are watching along with a coworker and you're not registered, or I'm not seeing that you're signed in on Zoom, just shoot me an email. My email is aweb@swta.org, or on one of the many numerous emails that I'm going to send out today with the webinar recording and the survey and all those things. And just let me know that you attended with another coworker, and I'll create a certificate for you as well. Today, about 11:50, right about before the webinar ends, you will receive an email with a survey. Please take the time to fill out the survey on how we did on today's webinar. I want you to know that I personally read every one of those survey responses, and my favorite question is, what kind of webinars are you interested in? And so I use those as we build out our webinar series for the upcoming months, and it's really valuable information that you guys provide to me. All right, let's go to the next page. So a little bit about SWTA Nation. So we cover 8 states, all the way from Louisiana all the way over to Arizona. You don't have to be a part of one of these 8 states to be a part of SWTA. We have memberships for everyone, from transit agencies, businesses, and then people outside of the SWTA Nation. Our membership period is beginning soon on October the 1st. If you're interested in becoming a member of SWTA, I'd be the person that you talk to. So just reach out and we can discuss, what best, fits your organization. We have a couple of upcoming events for SWTA. We have a DC SWTA Advocacy Summit, which will be in October. You can find out more information about that on our website, or to reach out to me or to our executive director, Rich Sampson. Also, just save the date. We are going to be opening up registration in the next couple of months for our next annual conference, which is going to be in Albuquerque. Okay, today's presenter is Charlotte. Charlotte, you're going to have to help me out a little bit. I apologize. How do you say your last name?
DiBartolomeo, but please call me Charlotte.
Okay, awesome. She is the CEO of Red Kite Consulting, or Red Kite Project, which is a resiliency building firm which consults and trains work communities in high pressure industries to heal burnout and traumatic stress, and to raise the employee trust necessary for system change. Charlotte has trained over 10,000 employees, so we're super grateful to have her with us today. And I invite you to go over to LinkedIn and check out her profile and follow her. All right, I'm going to turn it over to Charlotte, and we're going to get this webinar started. Give us just 1 second while we make the switch.
Okay, I'm going to share my screen now.
Mm-hmm.
Okay, give me a moment here. I want to just.
This is always the most awkward part of the webinar, trying to get things set up.
It is. It is.
Okay, great, Charlotte. You are ready to go.
Okay. And I just want to, there might be moments when I will just turn this part down. I have a question. Uh, if I were to, let me see, shut this part, can you still see me?
Yep, we
Can
can
people,
still see
okay.
you and the presentation.
Okay, great. All right. That's good to know. All right. So welcome everybody. And thank you, Amanda, for that introduction. I really appreciate it. And I have to say that I was delighted to see how many people were signing up for this. I think this is great to know because I think burnout hits us in multiple ways in our organization. So I'm really delighted to be able to talk with you about it. You know, when I was first putting this thing together, I thought, I'm going to start with the research comparing how burnout really diminishes safety practices. And then I decided, I think the more important thing to do and the more impactful thing to do would to begin with the story behind why I'm so passionate about burnout and also about building resilient communities. So 23 years ago, I was a crisis interventionist and I was working with vulnerable youth and their families. And these were kids who were in gangs, who were going in and out of the justice system. They were sometimes living in the streets. There were occasional drug addictions that I was having to deal with. And there was, unfortunately, a lot of suicidal ideation and attempted suicides. I mean, you can imagine that was a really difficult thing, especially because I was kind of doing it alone. I did not have much support from my administration. And so eventually, I got burned out, and my burnout showed up as depression and anxiety and a deep cynicism for the system that I was working in. And frankly, I was no longer effective. And so I had to quit my job. I got I got some intensive therapy because I really was so depressed and so anxious. And I eventually returned to school and I got my master's in conflict transformation. And that led me to post war Bosnia, where I was so privileged to witness non government actors working to heal their communities after war and genocide. And I learned a lot from those folks. It was a pretty amazing thing. I just really felt like I had been offered this methodology that was so helpful to communities. And so when I returned to my hometown of Philadelphia, I don't know if anybody's ever been to Philly, but that's born and bred, and I'm a Philly gal. And I was once again doing outreach work. I was also doing victim offender conferencing at that time in mediations, and I was working in North Philly. And North Philly, if anybody has ever heard of Kensington, it's a really deeply impoverished community where there is this massive amounts of opiates going in and out. A lot of folks who were dying in the streets. And there was, again, that sense of not enough resources. The human service professionals that I was working with were getting burned out. And I could see at that time that we needed to bring back those practices that folks were doing in Bosnia, post war Bosnia, to try to heal our community. And those practices are, focusing on building psychological safety and fostering community support and helping people access necessary resources. And so, I just want to share with you that organizations are communities too. And so when we bring those back, to help, for instance, the public transit groups that we work with, those employees need to feel safe and also protected in multiple ways in these demanding jobs. And that includes you. I'm not just talking about, for those of you who are not in the front line, I'm not just talking about the front line. I want you to know I recognize that that's for everybody in the transit industry. So, look, I share my burnout story because, and it's hard to share. It's hard to say, hey, I was really burned out to the point where I was depressed and I needed deep therapy. It's hard to talk about that stuff. But I think it's really important for us to destigmatize mental health issues in our communities. And the only way we can do that is have an authentic conversation about it. And so that's why I bring it up. And I also want you to know that looking at the research for people who experience mental health issues, 9 out of 10 of us will in our lifetime experience something, whether it's anxiety or depression or something even more difficult to overcome. So just to say that, if you have been feeling alone, you probably shouldn't feel alone, because this is happening to so many of us. So, okay, let's get into it. In this, I'm trying to move this and it's not moving. There we go. I guess I'll just have to move it that way. In this conversation, I am going to review the data connecting burnout to diminish safety practices. And we will explore the challenges that are facing public transit as we navigate polycrisis and uncertainty. And we are in an era of polycrises where there's just one crisis after another, and you never get the downtime. We'll identify the causes and signs of burnout and how it impacts your work environment. And we're going to discover the characteristics of a resilient workforce where not just the front line, but middle management and leadership feel supported, get the resources, the supports that they need. We will also discuss challenges of supporting your team members when they show signs of burnout. This is not easy. And we will brainstorm strategies to overcome your own burnout while supporting others to build resilience. So we got a lot to talk about today. Okay. It's unfortunately not moving on its own. So there are 3 concepts that are underpinning this seminar that by the end, I hope that you will understand and agree with. And the first is that resilience is a team sport. While individual strengths contribute, things like adaptability and flexibility, resilience is still a shared responsibility in communities, and it's fostered by a supportive and adaptable system. Just knowing that probably gives you some kind of sense of, oh, well, this is going to be a tall order. Okay. The second part is without support, chronic stress leads to burnout, and burnout impairs focus and increases the likelihood of errors and accidents. And there's a reason for that. It's because when we're under threat, we have a very difficult time accessing our logical brain because we're just thinking about the immediate threat that's upon us. And the third piece to this is that chronic stress promotes feelings of powerlessness and being overwhelmed. That is what triggers the brain survival mode, the threat response. And it limits, our ability to focus on complex tasks and problem solving. Because again, we're not working in the front of our brain, the logical part of our brain. We're just reacting rather than responding. So, sorry, it is moving back and forth. Anyway, let's get into the research. So burnout negatively impacts job performance. It lowers your rate of attention and your thoroughness. And I want to point to 3 pieces of research that hit me hard. The first is a 2002 piece that was done by Clark Sloan, Soskowski, and Silber, and they really understood that it can impact people in terms of mortality. They looked at nursing staff who were reporting burnout symptoms, and amongst those who did, it showed significantly higher rates of patient mortality. Then there is the 2017 study that was done with 222 Colombian bus operators, and 65% of those reported burnout, and within that group, 18% had an increase in accidents and fines. And finally, the longitudinal study that was done in 2009 by Christina Maslach and her team, and she is kind of like, oh, she's the mother of burnout prevention. She's done so much research. She's out of California. And her longitudinal study took a look at business offices and machine shops and outdoor maintenance and management departments regarding the specifically workplace injuries. And it showed that unaddressed burnout resulted in significant increases in accidents on the job. And what was really interesting about that was each year that they looked at this, they noticed that if burnout was not addressed, it kept getting worse, So something to consider, there's only so long people can go while being burned out without it impacting them and their communities. So why do we bring this up, and why do I think that that the transit the companies that you work in and that transit industry across the country is experiencing burnout? Well, I think it's because we have a lack of psychological safety in transit. And that is the recipe for burnout and trauma. And so we could go farther back than 2020, of course, but we know that during the pandemic, transit workers were often the last to get PPE. And I know that's not across the board. I know that there were many places where folks did get their PPE, but in some places that I worked, their PPE was given out and taken back. I mean, it was really upsetting for the front line because they felt so discounted and it was very demoralizing. There's also this loss of employee community connection because, look, masks were extremely important and isolation was very important. And I am not suggesting that it wasn't. I believed in it. I certainly, believe in it when people are ill. I don't mean that. But I will say that masks stopped us from emotional co-regulation. Now, emotional co-regulation is a kind of a fancy term for people feeling lousy, it's like psychologically lousy, like they're anxious, they're in threat mode, they're angry, all of those things that happen when you get upset. And so when we do in normal times, we may come in and see a colleague, somebody who we have a good relationship with, and we show up and we say, oh God, I'm having such a bad day, it's so awful. And our colleague shows us concern on their face and makes us feel like we matter and that they're part of this with them and want to help us. And so that's how we emotionally co-regulate. We do it from infancy on up, where we learn to co-regulate with our caregivers. And so it doesn't stop when we get older. We need our community, the people that we feel safe with, to feel safe and supported. And that went out the window. People didn't go into the depots, they didn't go into the garages, they were just completely isolated. And unfortunately, some of that still continues, not because necessarily they're concerned about what is going to happen to them physically, medically. It's just simply people got into a pattern of just staying away from each other. And I see it across the country in public transit companies that I work in. Not everybody, but there are people who've just continued to isolate. Operations came to work while other departments stayed home, and that created a kind of division that I still see occurring in this industry. And of course, employees across all departments felt and continue to feel a lack of control over their work experience, which is a very big problem for trying to maintain your resilience. Management continues to be challenged by employee retention and absenteeism and scheduling services, and public funding is at risk. I don't know if anybody follows what's happening in the state of Pennsylvania, and you certainly don't have to, but I will tell you that for the last couple of months, our legislators have not given any money to public transit. And that budget was supposed to be passed at the end of June. It still isn't. And at this point, one of the companies that I work with, which is Southeastern Pennsylvania Transportation Authority, have been forced to use their capital funds to do operations. And so that's been so stressful for everybody. Our GM has been amazing at handling all of it, but it's really a difficult experience for everybody and creates a lot of concerns. So continuing, transit and city police lack capacity to fully protect transit workers. And, this is not a cut on police officers or transportation police. I think that so much of this has to do with just a lack of resources. There aren't enough people to go around. And the front line and their supervisors on the street and middle management and upper management feel the heat of that. They understand that people are sometimes at great risk and do not get the protection that they need. The national political division, that uncertainty about the future, the fear of the other, folks, that does not stop when you walk through the doors of your work community. It doesn't mean that people aren't professional with each other, but there is a lack of cohesion in our work communities because we are a microcosm for what's happening for the rest of the world, right? And the rest of the country. Certainly, there's been an increase in vulnerable populations riding the system. And we know that part of that has to do with the fact that there have been resources that were cut for those folks. And there are more people who have opiate crises that are coming onto the system. And that again creates this sense of, well, what do we do with all these folks? Why are we now housing the homeless? Why are we dealing with this? We weren't trained in this, and that can create tremendous burnout. And mental illness amongst ridership has increased. But I would also add, after sitting in circle with people, frontline people, I would say that mental illness has increased for the front line as well. And people are really struggling. I probably don't have to tell you that. You probably already know that. But there are some folks who really are having a hard time. So who's providing mobile services to communities feeling the impact? Obviously, it's the transit workforce. Frontline transit employees are human service professionals. And occasionally, your first responders to crisis and conflict, which is traumatic for everybody. We started in this industry back in 2010. I was asked to come in to work with people on customer service, help people to, deal with difficult customers and customer service. Doing the needs assessment made it really clear that you were more than customer service professionals, that you were human service professionals, and that you needed to get the same kinds of training that human service professionals get, especially those who are having to go into crisis and conflict, because that can be an extremely dangerous thing. Transit managers are supervising your escalated, burned out frontline, but you're also having to adhere to policies that are dictated by the FTA and negotiated contracts. And I think that's a hard thing to hold, to try to be humane with people, but that you have to do discipline and sometimes let people go. That's really difficult because you are so stressed and, dictated by the FTA. Not to say that that you shouldn't be, but that is one of the big challenges. Non-operations personnel, talking to a lot of those folks on the side in small rooms, procurement, finance, HR, they also have high psychological demands and lower decision latitude. And so when I say lower decision latitude, I mean that their hands are tied a lot of times. They're told what to do, and they've got to do it. So they don't have a lot of autonomy either. And even at the executive level, they're still answering to boards and they're answering to the city. And so everyone's feeling the heat of that. So let's get into the signs of burnout so that you can take a look at this. And I want you to think about this in terms of the people that you may manage or the people that you co-work with, and also yourself. So an individual with burnout commonly will feel overwhelmed by simple tasks. Things that they could have done a year ago, no problem, but now it just feels like this big thing. Oh God, I got to do that. People feel betrayed by their organization and they speak negatively about leadership and coworkers, which is also one of the reasons why burnout can go viral. Standing around listening to somebody be negative all the time because they've had a bad experience, it's really hard to distance yourself from that unless you literally distance yourself physically. They will exhibit impaired cognition and poor judgment, again, because they're in threat mode. And so they're just trying to survive. And that means they're more quick to fight or run or just kind of fold and not make any decisions at all. They show decreased engagement in their work, and that is where you'll see the pattern of lateness, the absenteeism, lowered quality of work. Also, they'll overreact or underreact to challenges on site. Well, I know that in my own team, I've seen people who are taking on way too much work, and you're saying to them, "Are you sure you can handle this?" And you're like, "Yes, yes, yes." And then all of a sudden, they blow up, and it's hard for everybody because you're thinking, "Why did this make you so angry so quickly?" Because it's like you go till you are so full that you spill over. So there's that increased irritation and agitation, and a lot more conflicts occur. There's also increase in self-medicating through substance use and abuse. And that is hard because, you're dealing with people, you got to make sure that they're fit for duty. And it's not really surprising that some folks turn to alcohol and drug use, but that's not the only thing people will do. They will do process things like gambling and overspending or other high-risk behaviors. There's also a limited ability to feel and express empathy. That feeling like, I've heard operators say this, I've heard supervisors say this, I'm not the same person I was when I started this job. I used to care more about people, be more empathetic, and it's just kind of taken it out of me. That is really common, and it is also not a cut on your character, your character. It's just something that humans end up doing when they're overwhelmed. So now, if I can move this, there we go. We want to know what you're noticing. So we'd like you to take the poll, and the poll is, should I stop sharing at this point so that people can see it?
Give me just 1 second. Let me find out.
Okay.
One
So,
sec.
no problem. And so what we're going to do with this poll is you're going to take a look at those signs that I just spoke about, and we'd like you to prioritize them. If what you're seeing the most. So I think we have, what do we have, like 1, 2, 3, like the most, it would be 1 thing, 2, and 3.
Yep, give me just 1 second.
Okay.
Okay, there we go.
Oh, great.
Did everybody see the poll? Okay, good.
Hmm.
Good. Looks like we got all kinds of responses coming in. Great.
Yeah. Hmm.
Okay, great. I think that's a
Wow,
lot of
this is,
responses. Do you want to go ahead and
yeah, no, this is really, really fascinating. Thank you, everyone who participated in it. So what I'm noticing is that, uh, this strikes me as the feels betrayed by their organization, speaks negatively about leadership, coworkers. A lot of you, 55% of you, felt that this was a pretty significant issue. And I would agree. It's just when I listen to folks and I hear it takes time for them to really, unpack those complicated feelings, and they're frequently just spewing it. And feeling the betrayal is, look, sometimes the betrayal, it makes sense to me, but other times it's just kind of like where everybody ends up being. And so that's a big piece. And then, of course, shows decreased engagement in work patterns. I know that this industry is really struggling with keeping people in the seat, and keeping them, keeping the platforms clean, all of the things that happen to people that and don't show up, and then how that impacts all of you. And um, the overreacts, underreacts, we got 37% on that. Um, the increased irritation, agitation, in conflict with others, 50%. So yeah, thank you for doing this. Really appreciate it. Okay. So now that we know that you are seeing some things, thank you. Shall we stop? Do I just stop sharing those results, Amanda? So that I can move on?
I just did.
Okay. Okay. I'm still seeing it on mine. Let me just, hold on a second. Because you're probably seeing it because I'm sharing my screen. Let me do this. Oops, nope. Sorry, everybody. I stopped sharing because I was trying to get rid of this. And now I'm coming back too. So let me just come back and find this again. Okay. Here we go. Okay. So let's get into what the World Health Organization thinks about burnout. The WHO defines burnout as a syndrome resulting from chronic workplace stress that has not been successfully managed. Now, when I look at that definition, and maybe you see this too, it sounds to me like it's an individual problem. But I'm here to tell you that it's not. That is, yes, it is an individual problem. Obviously, it impacts the individuals, and characteristics of resilience are part of this if you have more resilience than others. But this syndrome is about workplace stress that has not been successfully managed. We know that in multiple industries, it's very hard to manage stress because, for instance, first responders of any kind, police, medical, you can't really predict what's coming next. And the same is true. Let me just admit another person here. And the same is true for public transit, because again, you folks are often first responders to crisis and conflict and are dealing with a whole heck of a lot. So thinking about this in terms of the whole community, I think can be really valuable. But let's talk about the distinguishing characteristics of burnout. So if you were to go to a psychologist and maybe needed to know what was happening for you, these would be distinguishing characteristics of burnout that they are looking for. So one is emotional and physical exhaustion. Emotional and physical exhaustion is this thing that happens where you maybe got 7 to 8 hours of sleep. But you wake up in the morning and you're like, I got no time for anybody's drama today. Anybody messes with me, I'm just going to do my thing. I cannot deal with all these crises that are occurring and everybody else's emotions. So that's number one. Two would be reduced professional efficacy. That's like you're a hamster on a wheel. You keep going in circles. You just are constantly going in motion. But it feels like all of your list of things to do, you get rid of some and it's back again. So it's that reduced professional efficacy. And it starts to weigh on you in terms of your own characters. Like, this is not who I want to be. I know the kind of work ethic I have. And it's so frustrating. And so that can result in this cynicism that, results in mental distancing. You get to a certain point, it's like, how much can you care? Right. And so you kind of like, all right, this is my job, but there's nothing I can do about this. I'm just going to put in the time. I'm just going to do what I got to do just to get through. And the distancing can also be, rather dangerous. I've heard operators say many times, I don't know how I got from one end of my route to the other. I think I stopped at every red light. I think I stopped at every stop, but I don't really know. And unless somebody calls me into their office, I'm not really sure. That's that mental distancing that people do. And finally, that decreased empathy. Decreased empathy is when someone comes to you and has a truly awful thing happening to them. And you see them, you try to show concern, but you just don't have the empathy you used to have. It just doesn't register for you in the same way anymore. And again, that's part of that mental distancing that occurs. But also, let's be clear, it doesn't just stop at the office or, at the depot or on the job. We take that stuff home. When we're burned out, you come home and maybe your kids are, my dad, and you're just like, oh, or your spouse is telling you what a terrible thing happened to them and you just don't have it in you anymore. That's decreased empathy. And so it impacts your personal relationships as well as your professional relationships. But I like to think about burnout as the metaphor that it is. and it's a fire, right? We have a fire when we start a new job. We have passion. We are motivated. All of that is really exciting, right? You start a new position in the company, but the fire goes out when we don't have enough resources. And it's, in a fire, if you ever built a fire in your fireplace, you know that there are certain resources that you need. You need oxygen and you need wood, but you need dry wood, so it's got to be good quality, right? You need to maybe clean up your flue. You need to continue to give wood and to help to keep this thing going. And so if you don't have enough of your needs met, which is resources, needs like safety needs, and we have these universal needs, that's safety needs and community need, self-esteem need, which comes with respect, and physiological needs like am I eating properly? Do I have enough time to have a lunch? Do I have enough time to go to the bathroom? So when these things are not happening for you, you're not getting enough resources, yeah, sure, you're going to be more likely for the fire in you to go out. So let's hear from you. This is the moment when I'm really hoping that a few of you will speak up. And so the question is, how do you use your community? Because community is a resource. A good, solid community can be a resource. And your relationships, whether it be in your job or outside of your job, to alleviate your own symptoms of burnout. I'm looking here to see if we can have anybody unmute, if they have anything they want to say, or, whoops, let me just move this back. Anyone speak about this?
So you can unmute and just speak up, or you can throw something in the chat box and we can, let everybody know for you.
I have regular conversations with family members when I'm feeling burned out. Even from my father, he told me yesterday, make sure you're taking care of yourself. And so there are opportunity for me to give them information about what's going on without trying to get into the mode of complaining.
Oh, thank you, Jared. I appreciate that. And it's good to have solid family. That's a really big help. Also, that idea of taking care of yourself. I think of it in terms of when you are on an airplane and they say, like, in the unlikely event that oxygen will go out, you put the mask on yourself first. And a lot of times in this industry, people do not do that. They don't take care of themselves. So thank you.
Hi, I will next. I do a daily morning kind of devotional that gets me started every day. And then as far as my team and just extended team community and workspace, because we invite others to participate. We do a Thankful Thursday. We do a Thankful Thursday that we where we get together and we just talk about things that we're thankful for. And it helps just foster positive communication amongst our peers. And there's other opportunities for us to vent. Sometimes it comes out in meetings, but we allow that space so that the employees can get those things out and then we can move forward. But I know the Thankful Thursdays has been very helpful in just having everybody on the same page and realizing what really matters and what are just some of the things that we can continue to work through, but that we have each other, we're together, and we are here to support each other.
Oh, that is beautiful. That's wonderful.
We're seeing some really great things from the chat box. Somebody has a standing appointment with a therapist every few weeks, which is a great way to work through some things. Another, I enjoy working outdoors. It's a great way to disconnect. I call a friend who always makes me laugh and does not display judgment. Creating a positive environment in the workplace, employee committee, focus on the good. Focus on a hobby that is enjoyable, not to dwell on previous situations. And somebody says, I believe it or not, I utilize Copilot, the AI by Microsoft, to have a little whimsical chat when I'm feeling overwhelmed, and it helps a lot. I haven't heard of that one, so I really like that, Danya. Try to walk every morning and listening to worship. Enjoy a motorcycle ride.
Great.
Good
Beautiful.
afternoon. I started playing Pokemon, like the card game, and I try to go 2 times a week. The only thing is it's hard because of my schedule. When I close, I can't go in the afternoon, or on Saturdays when I work, I can't go. And I really do enjoy it because I forget of all the problems and everything going on. And it's time for myself, and I'm with my community members because it's everybody from different paths of lives.
Yeah.
And we're just all there playing for 2, 3 hours with no distractions. Because phones have to be off because you have to be concentrated just on the game. And it's something that brings me so much peace, and letting the load off of work or personal life that I carry, because as a dispatcher, well, you're
Ugh.
responsible for a lot of things.
Yeah.
I'll touch on it. You're a dispatcher in transportation. One thing I want to say is that we speak about individuals, but transportation 24 hours, 7 days a week. And that is one of the least, if not the least, recognized community of individuals that do not get attention from upper management, do not understand the stress and the burnout they go through on a daily basis. From the minute they walk into the vision at 3 in the morning, 4 in the morning, they already stressed because they know they don't have any support. Even before the pandemic and while the pandemic was going on, transportation was never mentioned, and we transport more people than anyone in the United States daily. We make hundreds of stops daily, and the drivers go through so much, and upper management expect for drivers to be perfect, and they never sit behind the wheel. So when we speak about stress, we need that support in transportation, and HR, they need to address those issues with burnout instead of terminating individuals, suspending them, because you can't be perfect with individuals. And you mentioned earlier, there's a high rate of mental disorder passengers riding the bus now, which it is quite a bit. I mean, I see it every day, all day long, and drivers don't have training to deal with them.
Right.
So I would suggest that maybe upper management will give drivers more support when they get out there on the front line.
Thank you. Yes.
So
Anyone
Charlotte,
else?
one thing that I noticed in myself when I'm stressed is that I'm so stressed out, I don't make the time to do things like go to Pokemon or go to yoga or go for a walk or do the things that I know that make me feel better. It's almost like you get in a spiral that goes down, and it's really hard to keep those positive activities and hobbies going when you're not feeling your best.
Yeah. Yeah, it is. Yeah, once it starts to spiral down, it's harder to get back out, I find as well. So thank you for mentioning that, Amanda. It's really important. Anybody else?
Somebody else mentioned that that they speak with mentors that understand the transportation industry and can provide solid advice. I personally think that this is a great idea. Talking with people who are experiencing the same things that you are and can provide some insight. It's always a great idea.
Yes, it is. And I'm going to get into that in a minute. So thank you for bringing that up.
All right.
Okay.
Thank you, everybody.
Yes, thanks everyone for sharing that. Really great things came out of that, and things that make me think, yeah, I need to do more. The hobbies and getting together in community that's not necessarily transit can also be really useful. So thank you. Okay, so let's get into the causes of burnout. This will probably not surprise you, but I think it's important to go over it. We know that communication firewalls between departments, I'm talking about beyond silos here, I'm talking about people having fear of telling the other department what's happening. And I've seen it, between HR sometimes, and operations and procurement. And so nobody kind of knows what anybody else is doing. And then you're trying to make decisions based on only what you know. And there are not the communication bridges that need to happen for us to all function in a way that supports the work. And I know that when we do upper management training and middle management training, and we put folks together from different departments, things will come out and say, I had no idea that was what your job was. I had no idea. Oh, and so then they start making those connections with each other so they can start having those communication bridges. Really important. A culture of blame versus a culture of support. again, FTA regulated, your supervisors are out there looking for, it's accident investigation. There's some specific ways that we have to be and what we have to do when we are investigating and disciplining. But the question is it done in a way, are you having a hard time being humane about it? Do you know what it even looks like to be humane when you're given this really heavy task? Because I think that's hard for some people. The heavy workload without sufficient recovery time. I know we talk a lot about it for operators. They go from one end of the route that frequently don't have recovery time. There's lots of reasons why that happens. But it's also heavy workload without sufficient recovery time for supervisors and managers too. The high responsibility and low decision latitude, where you lack control and autonomy, that is extraordinarily hard because oh, I have responsibility, but I feel I have no power here. The unresolved psychological trauma, critical incidents that get swept under the rug. Having sat in circle with so many people, I hear stories, my team hears stories, and it'll go something like this. I had an accident. It was a pretty bad accident. I hurt my shoulder and my neck, and I was out for a couple months, and nobody came to see me. Nobody cared. And it was awful. And they don't bother just looking at or even making me feel like I mattered. And you'll ask them, when did this happen? And they'll say 15, 20 years ago. And so people hold on to that stuff. And when we don't acknowledge, or when we had a conflict or a crisis and we don't address that, in this industry, we're always like, oh, we got to keep it moving, but that can harm us and harm a community. And then being unprepared to manage conflict and crisis. And then there's something called moral injury. I want to talk to you about moral injury because I think that this is happening more and more to people. So I'm going to just read the definition of moral injury for those of you who don't know. Moral injury is a psychological injury to a person's moral conscience and values, resulting from an act of perceived moral transgression on the part of themselves or others. And so it produces profound feelings of guilt and shame, moral disorientation, and social alienation. And in some cases, it causes a sense of betrayal and anger toward colleagues, commanders, and the organization they work in. I'm going to give you an example of this. A transit professional is maybe running a depot or where all the buses come in, and they've got a homeless woman with her small child who's hanging out there all day, and it's now time to close things. And so, you can't have them stay here, but you also know they have no place else to go. And folks get put into that position all the time. And so they must clear them from the area, but they're thinking, maybe they'll say, look, I think there's a shelter. How am I supposed to get to it? I can't get to the shelter. I have no place to go now. That weighs on people. Also, this sense of lack of fairness and within the community, the work community, and then this perception of retaliation may occur if they speak up. Again, sometimes people do retaliate, but sometimes it is just a perception. And that's something that creates burnout. And then feeling dehumanized. Just this idea of having to send somebody out in the dark with their small child, it feels dehumanizing to the person that they're doing this to, and it also feels dehumanizing to them. And the work, of course, is how many times does an operator or someone say, I'm just a number here. So people feeling dehumanized. I thought I had more, but I guess not. Okay, so what's your experience? What are your challenges of supporting your team when they show signs of burnout? You've already talked about some things that you do, which are wonderful, but is there like an intervention that you try to do individually with someone, or do you discuss it in a bigger way? What are some things that you do? Anybody want to speak on that? Because it is a challenge.
Okay, no one speaking. One of the things I usually do, because I train de-escalation as well, I try to empathize with them to the point where I've been there. I started there. I understand the things you're going through. And, not to belittle the operator per se, but you come through those situations where you really feel sad for individuals, like the story you mentioned about, moving people out, and they come back with all these questions and you don't know how to respond to them because you wasn't trained and that's not your profession. And it gets real difficult and it weighs on you on a period of time because you have to be the bad guy, pretty much. And that's what I have to do all the time, be the bad guy. I don't like it, but I have to do it. And I try to empathize with them no matter how many times I have to deal with it. I try to empathize with that individual, knowing the hardships they're going through, because everyone has a story.
Yes.
So you have to empathize with them, period, no matter how hard it is. And then for me, I have to work out to keep my sanity. That's what I have.
That's good.
And at the
Good.
same, train drivers how to de-escalate.
Yeah, I'm really glad to hear that you're also addressing it for yourself, and that's important because it's really hard to help other people after a while when we don't have it in us to do something. And movement is wonderful to do that, because what you're doing when you're exercising is that you are burning off those stress chemicals that happen when we feel that we're under threat. And that happens a lot where you see it in the front line where they're driving all day long and they're trying so hard to keep it together, but they're not moving, and they just had a bad interaction. The next thing you know, they have another interaction with somebody else, and it just builds up. Okay, well, we can move on because I have a little more to go, so I will. So, look, burnout is contagious and it requires a collective response. We know this because when it doesn't happen, as again, that longitudinal study, when we don't respond, it creates even more problems. So building resilience is a team effort that begins by repairing relationships. Remember, I talked a little bit ago about how people hold on to things. They do. And and it kind of stirs in them, but then they'll also share that with somebody else. And that's how the rumor mill goes. But when we're trying to repair relationships, work relationships, acknowledgement, like you just said, that, thank you for that. Acknowledgement is really important. You're empathizing. You're saying, look, I get that this has really been difficult for you. This experience is so hard, and that you got put into this. Just saying, like, being able to see that this person sees me and recognizes what I'm going through can be really helpful. And that's that compassion piece. Again, it helps people to co-regulate with each other. And then we want to make sure that our promises can match our actions. And if we promise something and it turns out we can't do it, then we need to go back and follow up, So that's a really important piece to this. And then having the hard conversations, using collaborative processes to repair and to help people to feel like they've got more power in the situation. So, like, what can you do next time that will make it easier for you and also stay within the guidelines? Those are collaborative processes. We teach it all the time. And, unfortunately, I don't think that in our schools, we really learn a lot about collaboration and dialogue. We learn about debate, but we don't really have the ability or the skills to have those conversations. And that can make it more difficult. Also, what does a resilient workplace look like? I just want to share this with you. We know that resilient workplaces happen when employees show concern for one another and they feel empowered and trusted to make decisions. And again, in a transit industry where everything is regulated, that's hard to do. But if you're making decisions and you're not even asking your team or the people that are out there on the street, then they feel like, they don't matter and that you don't value what they're seeing and doing. So they employ system-wide health and stress interventions and individual support measures for the workforce. So that's things like, maybe having an exercise room if that's possible, or creating something where people going for walks and it gets more involved in the community. We know that although the pace and intensity of work may not change, leaders need to identify and meet employees' needs when possible. So, as I said before, we have human needs. They're universal: safety and security, physiological, community needs to be able to be with each other, and then that respect, that esteem. And so finding ways to meet those needs, even in small ways, can make a difference. Employees trust that leaders and coworkers have their back. Finding ways to show that you have their back is vital. And here's some best practices that folks are doing around the country, and you may be doing too. Somebody mentioned mentors. I think that's great. Peer support programs, not just for the front line, but for management too. I find that this and developing mentorship and coaching best practices with supervisors and managers is vital. And part of the reason why I think that's vital is because you know how this transit industry works. You are doing a great job in something and you get promoted, and then often no one's really coaching you through it. You just kind of, maybe they'll give you a book and they'll say, okay, this is what you got to do, or you'll follow somebody for 3 days and that's it. But we need to have those regular coaching sessions in order for people to fulfill their duties and also feel like they can become competent in this work. So paramentors with new hires, that's essential too. And then build in opportunities for flexibility within small teams. Really hard to do. I get that because of the way the industry works. But if somebody needs to take their child to an important doctor appointment, finding ways to help them out through that. Regular meetings with senior leadership to hear concerns. And then senior leadership needs to follow up, respond to that. Okay, here's what we took your advice on, this is what we did. Here's what we couldn't do, and here's why. That's the way we follow up. And then training and trauma-informed and needs-based conflict de-escalation skills, because if we think that, and oftentimes the frontline does, especially think, I'm going to match their anger with my anger, and I'm going to settle this down. I'm going to put this down. Well, we know that we're dealing with a traumatized public, collective trauma. And so whenever somebody has experienced trauma, they feel powerless. And the last thing you want to do is to disempower them even further. That will raise them, and then you'll get into a match with them. So training people in that is very important. That is the end. If anybody has any questions, though, this is a great opportunity to, I would like to hear from you. We still have a few minutes left, I think.
We do still have a few minutes left. So if anybody wants to unmute and ask a question, now's the time. Just a couple of reminders. The survey did go out. We are experiencing a few problems with our registration system, and I normally am able to get out the certificates like really quickly. It may be tomorrow. There's a problem with the system. And so as soon as that's corrected or fixed and they get that all done, I will get out the certificates. Just a reminder, if you watched with a coworker, please let me know. One person did let me know, and I will make sure that you get your certificate. And we're going to stop the recording here in just a second. And if anybody wants to stay on and ask a question offline, you're welcome to do that as well.
And I'm seeing some really great pieces here. Thank you. I'm loving what you're saying and some of the things that you're already doing. So this is wonderful.
Great. Okay, I'm going to go ahead and end the recording. And if anybody wants to stay on and chat with Charlotte, please feel free to do so.